Larsen, and I'm from Washington State, 2nd Congressional District. For those who don't know exactly the boundaries of the district, just think of north of Seattle, but including none of Seattle. So Snohomish County up near to the Canadian border, including the San Juan Islands and Island County. And we've got a really great panel for you today to discuss not just the Affordable Care Act, but more importantly, the fact that here in Washington State, we are in the open enrollment period, and we're trying to encourage folks to enroll in a health plan to ensure access to health care for everyone in our state. And we've got a great panel who I will introduce in a moment, who will also give presentations to help us understand kind of where we are in the healthcare world today and how you can participate in open enrollment. So thanks for joining us today. Just a heads up, open enrollment for healthcare, and we'll talk about this date, ends December 15th. It ends on December 15th. So keep that in mind. That's one of the dates, important dates that you ought to keep in mind. But ensuring access to high quality and affordable healthcare in Washington State is one of my goals, and it's the goals of the folks that we're going to be hearing from today. And I strongly support universal health coverage and believe we can use the Affordable Care Act to get to that goal. In fact, we were well on our way towards that goal through 2016. In my view, we've hit a 4-year bump in the road, and we'll get an opportunity to get back to increasing access to healthcare and making it available. So for instance, the Affordable Care Act became law in 2010. And more than 3 million of our neighbors in our state of Washington with pre-existing conditions have been able to access health coverage. The state's uninsured population decreased from 14.2% in 2010 to 6.2% in 2018. So we were making progress. It is back up to around 7% due to COVID-19, the pandemic. And we're going to get through that too. And we may do, not with this group today, but we may later this month do a webinar or Facebook Live event on the pandemic itself. So watch for that as well. In 2015, Washington State built the Health Benefit Exchange, a public-private marketplace for people in our state to shop, to choose, and compare healthcare and dental coverage plans. Since then, more than 1.7 million people have signed up for health coverage through the Washington Health Plan Finder or Washington Apple Health, which is the brand we give to the state Medicaid provider, and signed up. 1.7 million people signed up in the last 5 years. And according to the exchange, and Pam MacEwan's on this, I'm going to ask her to fact check this. This just seems crazy. According to the exchange, one Washingtonian is signing up for health coverage every 30 seconds during the open enrollment period. So I'm going to challenge her on that. But that began on November 1st. It just seems like a lot of people, but if it's true, it's true. The ACA's positive impact, though, can be measured beyond just numbers. I've heard from hundreds of my constituents about the benefit of the Affordable Care Act and Healthcare Exchange. Sue from Everett told me that her son was recovering from drug addiction and had no other health insurance coverage other than the coverage he had through the ACA. And because of the care that he received through ACA coverage, Sue's son was able not to worry about healthcare and was able to focus on getting clean, which he was able to do. Debbie from Camino Island was laid off from her job and forced to retire early as a result. Too young for Medicare, with no means to pay for health insurance. She benefited from an affordable exchange plan as well. And Michael from Bellingham, 3 generations of Michael's family, all educators, benefited from the Affordable Care Act. He purchased private insurance through the Accountable Communities of Health. His parents and mother-in-law received coverage through Medicare, and Michael's children received care through Washington Apple Health. So all using elements of the ACA changes that we made in the past. And Michael wrote to me and he said, the ACA is not perfect, but it helps real people access the care they need. I agree. It does help people and it is not perfect. That's why I'm taking steps to strengthen the ACA and ensure that the folks I represent in our state continue to have access to quality, affordable health care. And earlier this year, the House passed a comprehensive bipartisan bill, the Patient Protection and Affordable Care Enhancement Act. It does several things: lowers healthcare coverage costs by expanding the tax credits that were available through the ACA and allowing more middle-class families and individuals to qualify for federal subsidies. We passed legislation to help negotiate, to give the federal government the ability to negotiate lower drug prices. We passed legislation to expand coverage and push holdout states, not Washington State, but other states, to adopt a Medicaid-like expansion, which Washington State already has. And we're trying to combat inequity in healthcare coverage too, faced by communities of color. And finally, we wanted to crack down on these junk plans and strengthen protections for people with pre-existing conditions. And maybe one of our guests from the Insurance Commissioner's Office can address some of those kinds of issues that we're facing in our state and how to address that. So I'm really excited about this panel because it's a broad variety of folks. We've got someone from the Health Exchange, someone from the Insurance Commissioner's Office, and someone who operates as a navigator through one of the community health plans. We have Pam MacEwan, who's the Executive Director of the Washington Health Benefit Exchange, and welcome, Pam. Jane Beyer, who's a Senior Health Policy Advisor with the Washington State Office of the Insurance Commissioner, and thank you for joining, Jane. Can't wait to hear more about your role. And just as a matter of history, I know Jane since I worked down in Olympia in the mid-90s, early 90s. And I can tell you she knows a lot more about healthcare than anyone I've ever met. And so no pressure on Jane. And then Anna Howe, who's the Managed Care Regional Coordinator for CMAR Community Health Center. So thanks for joining, Anna. So we're going to take the panelists in that order, and I'll turn it over first to Pam MacEwan from the Health Benefit Exchange here in Washington State. Pam.
Thank you. Thank you so much, Representative. And first of all, I really appreciate you helping us to get the word out about open enrollment. It's really important. And I really appreciated your remarks. I thought like, wow, I don't need to say anything. That was really wonderful. So open enrollment started November 1st, as the Congressman said. And if you want coverage by January 1st, you need to enroll by December 15th. This year, because of the global pandemic and because there's a lot of new offerings on the exchange, we will also have an extension to open enrollment that will go to January 15th. But I would encourage everyone to get enrolled by the 15th of December so that you can have coverage beginning January 1st. We are seeing a lot of impact from the global pandemic on the exchange. More people are needing healthcare, and people are really struggling with affordability because of the economic crisis. What we're seeing a lot of is that people don't realize that they qualify for benefits. You are eligible for financial help for a discount in your premiums up to 400% of the federal poverty line, which doesn't mean very much to people. So to put it in other terms, that's $50,000 a year for an individual or $100,000 a year for a family. So it really is, middle income people are eligible for these discounts. And then right now we're seeing a lot of people come into the exchange and they're qualifying for Apple Health. And what this makes me realize is that they didn't realize they were eligible for these benefits because you can apply for Apple Health anytime. And they were waiting for open enrollment. So if you've lost your job, you've lost your income, you may be eligible for these benefits. And that coverage is really comprehensive and you don't pay anything. So I really want to encourage people to kind of come in, take a look, shop, and choose a plan. The good news for people this year is that premiums have gone down by an average of 3.5%. That's good news, although as we heard before, premiums have been climbing really dramatically before that, but any leveling off is welcome. And so that means that your premium may look the same as it looked last year, which is always good news to any consumer. And then this is the first year for Cascade Care plans, which is really two different offerings that are coming through the exchange. One is what we call standard plans. And this was designed to help people deal with really high deductibles. Deductibles were climbing every year and the cost sharing was going out of reach for people, or they were feeling like they got no value from their health plan. By the time they paid their deductible, it was time to start a new year. So these plans are designed so deductibles are usually find about an average of $1,000 less. And more is covered before you have to pay the deductible. And this includes primary care visits, coverage for mental health visits, and also managing chronic care, chronic illnesses. And then the other part of it is the public option. Our state was the first state in the country to pass public option. And this is the inaugural year. We're just launching this program, but this is really, it's going to be available in 19 counties. There are 5 different carriers offering it. And I didn't have an opportunity to look at what's available in Representative Larsen's district. I know there are some available. And these plans are negotiated between our healthcare authority and the carriers and the providers to provide lower premiums and higher quality. And so this is the first year we're putting them out. You take a look if they're available in your county. I think it may provide more value to you. I really want to encourage people to look at their options. I think one of the things that, think about, well, how long will it take me to apply? Well, the website works really well. It shouldn't take you very long to apply at all, but I'd encourage you to take a little longer. Think about how much time you would take to choose a car, or sometimes even a toothbrush. I mean, people take a lot of time on consumer decisions. And when it comes to healthcare, it's complicated and overwhelming. And I think it's really important that people, take some time to look, think about your benefits, think about what your family needs, and because there really are big differences. And then really make sure that you're reporting income changes and looking at what benefits you might be available for. And the other thing is that because healthcare is complicated, there is in-person help available. Our call center is on extended hours, so you can get help there, but also we're going to be hearing from a Navigator shortly, and they are wonderful. They're really helpful at navigating between all the different programs, and then brokers also are available. This is at no charge to you at all, and I think the in-person help is really important. I think the last thing I would say is don't wait. Don't wait till the last minute. Please come in now, take a look now. And if you're eligible for coverage, please sign up as soon as you can. Thank you.
Yeah. Well, thanks, Pam. You've given me a lot of food for thought for questions. And of course, I'll hold off on those. And we'll go to Jane Beyer, Senior Health Policy Advisor at the Office of the Insurance Commissioner. What's going on in your office, and what do we need to know about healthcare this fall?
Okay, thanks so much, Representative Larsen, and thanks for those kind words in your introduction. That was very sweet. Yeah. So I want to talk just a tiny bit about how the work that the Office of the Insurance Commissioner does fits like a glove with the work that the Health Benefit Exchange does. The health plans that are offered on the Health Benefit Exchange have been reviewed by our office. We've reviewed those plans to make sure that they comply with all of the state and federal laws, including the Affordable Care Act. And we have reviewed those rates, and Pam referenced that the rates are down on average about 3%. And part of that is because we have actuaries that have very, very sharp pencils, and they go back to the insurers and they make sure that those rates are as low as they can be, but still high enough to be sure that they're financially sound and they can pay your claims. But what I do want to talk about is, and Representative Larsen referenced this, there are a lot of entities out there that are marketing health plans right now during open enrollment. And the healthplanfinder.org website, it is .org, right, Pam? The healthplanfinder.org website is the website to go to. There are so many lookalike websites that will say, healthbenefitexchange.com, or that will look a lot like the Affordable Care Act. And some of those websites are marketing plans that do not meet the requirements of the Affordable Care Act. They are selling people plans that exclude people with pre-existing conditions, that only last for 3 months, that are what we call indemnity plans, where they'll pay a fixed amount if you go to the hospital, but if your hospital bill is $40,000, your insurance plan might pay $1,000. And there are also entities that are out there that are marketing what are called healthcare sharing ministries. And there are some legitimate healthcare sharing ministries that are people who share a faith, a common religious faith, who share healthcare costs amongst themselves. But there are some entities out there that call themselves that. We just took enforcement action against one called Alera, and those healthcare sharing ministry plans do not guarantee that they will pay your medical claims. And so please, 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 if you see something that looks too good to be true, it probably is too good to be true. And our office is here, and the Health Benefit Exchange is here, and navigators like Anna are here for you to talk to. So before you press a button and say, I want to buy this, call us. And our phone number is 800-562-6900, and we're not limited in terms of our consumer affairs shop. We are not limited to just answering questions about open enrollment. Consumers call us all the time with all kinds of complaints, and I cannot tell you how critical consumer complaints are, because that's how we find out that health insurers are not doing things correctly. And we have the authority to go back to that insurer and make sure that they follow the law. So please, please, please do not hesitate to contact our office with any kind of a complaint. And I think during the Q&A, we can talk a little bit more about some of the actions that the commissioner's taken during COVID. But I just do also want to mention one other thing. There was a new law that the state legislature passed in 2019 that went into effect on January 1, 2020, and it's called the Balance Billing Protection Act. And that is a great consumer protection law. It passed our state legislature unanimously with full bipartisan support. And what that means is if you go into an emergency room and you're at a hospital that's not in your health plan's network, and you're taken care of by that hospital or a doctor that's not in your health plan's network, they cannot bill you any more than what they would bill you just as if it was you're seeing a doc or being at a hospital that was in your health plan's network. And if, for example, you have a broken hip and you're going in for planned surgery to get a repair or get a knee replacement, and you go to a hospital that's in your health plan's network, you're doing the right thing. But there might be doctors that practice at that hospital that aren't in your health plan's network. And under the Balance Billing Protection Act, they cannot bill you anything more than what you would usually pay for your cost sharing. So it is a super important new protection that's in effect. And we have tons of information on our website about it. And some of you may actually have already received some of the required consumer notices that have to go out when you are planning to have a procedure done to make sure that consumers understand that they cannot be balance billed. So I think with that, I am happy to answer any more questions about that as well. And with that, I'll pass it over to Anna.
Yeah, before I get to Anna, I just want to say thanks, Jane, because as a consumer of healthcare who got hit by a surprise billing, this in Washington State is an important consumer protection. Our son went to the emergency room. We took him to an emergency room in Everett, and the hospital itself was on the plan. The physician who treated him was not. And we got the bill and were surprised about how much we had to pay for the physician, because it was an out-of-network physician at an in-network hospital. So, and it just didn't occur to us, and it won't occur to most people because you're in an emergency situation.
Right.
So you don't want to stop to say, hold on, I need to call my health plan to see if this doctor's in our plan. Just hold off on healthcare for my child. So this is a really great protection. And at the federal level, we've been trying to get a similar surprise billing or balance bill legislation passed. And if we can ever get it done, I do want it to reflect how we did it in Washington State. So we're not changing standards, that we use Washington State as a model. So thanks for bringing that up. And it's also like that old, sorry, Anna, just one more thing. It's like that old commercial about the hair club for men to help men who are bald. And the president says, I'm not just the president of Hair Club for Men, I'm a client. Well, in this sense, like, I'm not just your congressman, I'm actually a guy who got hit by surprise billing too. I know what it's like. So this is really important in Washington State, what we've been able to do. Thanks. So Anna Howe's with us from CMAR. CMAR is a community health center network in our state, and they do great work, great outreach work in healthcare to a lot of populations of people of color, as well as anyone else who can be a member. But she also has a unique role as a navigator, and if you could explain, Anna, what a navigator is in the healthcare system, kinds of things that you do, and how people access a navigator as well.
Hi, thank you very much for having me. Yes, my name is Anna Howe with CMAR Community Health Center. I supervise the Navigator Program in Snohomish, Skagit and Whatcom County. The Navigator role is very intense and very helpful for our community. It's a much needed role to have a client be able to see us in person. CMAR is one of the locations that is still seeing clients in person for assistance in enrollment. We do also consultations over the phone, and we've tried the Zooms as well. The Navigator program will sit down with you, will go over the application, will help you enroll over the internet, over the online application. We'll do the online application with you. We'll go over the plans available in your area. We will go over the networks for those plans, but it is a great assistance. We have navigators all throughout the state on the west side. We have anywhere from Clark County all the way up to Whatcom County. Our main phone number is the easiest ways to get in contact with a navigator. That is the 1-855-289-4503, and you'll be able to get connected to a navigator for assistance. We've had seen changes come up due to the pandemic, but it definitely has not impacted our ability to see clients in person.
Anything else then on that before we get to questions?
Yes, if you do want to find a navigator in your area, you can call us directly. We'll be able to connect you to a navigator in your area. If you visit the WashingtonHealthPlanFinder.org, you can also find a navigator or a broker in your area there as well.
Okay, great. Well, let's thank you all for providing opening comments and being willing to be part of this Facebook Live and to answer questions from me. We brainstormed some questions ahead of time in my office, and I think I want to start with Anna about navigators and specific to CMAR. Can anyone, does CMAR have a membership or can anyone access CMAR healthcare? And as a result, can anyone call CMAR and have someone from you all be their navigator?
Yes, our navigators at CMAR are open to the public, so you do not have to be a CMAR patient to access our navigator program. With CMAR, we see a wide variety of, we accept a wide variety of insurance, but we also accept patients who don't have insurance, and we do have a sliding fee scale set up for them. But to access our Navigator program, there is no membership, or you do not have to be a CMAR patient. Anyone can access it, and we are searchable in Washington Health Plan Finder as open navigators.
Okay, so you can go to the WashingtonHealthPlanFinder.org, and there's a tab for navigators, and you can click on that and be connect or not connected, but find navigators through that website.
Correct. It will give you the contact information and the organization for the navigator. If you do want to search for a CMAR navigator, you can always call our contact line. That number again, it's 1-855-289-4503. We'll be able to connect you to a navigator directly or tell you the nearest navigator in your area.
Yeah. So it sounds like the answer to someone's question, where do I start? How do I choose? Where can I get help to choose? The answer is navigators.
Yes.
That's why you all exist. Yeah, great. Well, I'll come back to you, Anna, with a few more questions. Jane, can you tell me about the process? Can you tell the public about the process to ensure that these rates that Pam and you discussed, these rates through the exchange, are, that you have done the accountability, the transparency, you force the insurance companies to be sure their numbers were right so you can get the most affordable product? Can you tell the public how that works a little bit?
Sure, I can. So we actually start when the health plans that are going to go into effect that you're signing up for now, that go into effect January 1, 2021, back in May of this year is when the health insurers had to file with us a description of the benefits that they wanted to offer and their proposed rates. And so we have two different parts of our organization. One that's reviewing those health benefit plans to make sure they're complying with all the requirements, not only of the Affordable Care Act, but that our state legislature has enacted to make sure that consumers can access healthcare services. And then on the rate side, under the Affordable Care Act, there's actually it's called a template that each health insurer has to fill out for each plan that breaks down the costs and every component of their plan. So we are looking, for example, to make sure that an insurer isn't putting too much money aside for profits. And we are making sure that when they're projecting how much they think healthcare costs will be in the next year, that those are reasonable assumptions. And essentially, we're also making sure that when they set their rates, those rates are not varied based upon a person's health status. The only reason a rate that an individual pays can be different is based upon their age, mainly their age, whether they're a smoker, and whether they're buying a plan just for themselves or for their family. The rates also vary a little bit by the part of the state that somebody lives in, but for people in your district, that's one rating area. So you cannot be charged more because you're a woman. You cannot be charged more because you have a pre-existing condition. It's just based upon age. But there is a pretty significant difference in premium between the youngest folks and the older folks. And Pam can explain it better, that difference in premium for folks who are low income enough or moderate income enough to get help with paying their premiums. The way the help from the federal government goes under the Affordable Care Act, if you're older and your health plan costs more, then you'll get a higher premium tax credit to help you pay for it. That's based upon what your income is. So we, like I said, we have very sharp pencils and we go back and forth and back and forth and back and forth with the insurers. When we have questions, we ask them a question. They have to respond to it. For example, we have to make sure that they're complying with the federal mental health parity law to make sure that people who need substance use disorder or mental health treatment aren't treated any more stringently in terms of how much they have to pay than somebody who needs to go to a cardiologist, for example.
Yeah, thanks. I think sometimes people that I represent, they're very busy. They're busy doing a lot of things. These days, we're busy dealing with the pandemic.
Yep.
And so it's good to hear that we're kind of rely on some good public servants who are going through on our behalf to, as you said, sharpen those pencils to make sure these plans have been fully vetted before they get out and are sold to the public, as well as you noted in your opening comments, you're bird dogging the potential of bad plans, fraudulent plans, scams, and other things. So
the way that we learn about those scams is by consumers calling us, either when they're being marketed to and they don't know what they can trust, or unfortunately, when a claim hasn't been paid. Yeah. And then we go and try to do what we can do.
Yeah. Thanks. So I'll come back to you. I've got a couple questions for Pam. Have you seen, because of the pandemic, have you seen different trends in who's signing up this year versus say 2019 or 2018 or 2017, Pam? Has the pandemic influenced that sign up time, the demographics, anything that you're seeing in your numbers?
Yeah, that's a great question. It's had a big impact. We ran an open enrollment on last spring when the public health emergency was declared. So we just opened up enrollment into the exchange, and we saw a higher percentage of people under 35 years old coming for healthcare. And I think probably a lot of young people lost employment early on in the pandemic, which is one of the things that happens. And I think a lot of young people also said, oh, maybe health insurance is not such a bad idea after all. So I think some people kind of changed what they thought about whether or not they wanted to purchase insurance. We saw more people of color come in, which was, again, I think it might have been the impact of unemployment. So that was the big change. The other thing that was really different is people who had been, purchasing their healthcare on the exchange year over year. People were self-employed; their employer didn't cover it. We've been here 8 years. We actually have kind of a group of people that come back year over year. This time, there are people who had health insurance through their employer their entire professional lives, and all of a sudden, they were left without resources. And they didn't know how to purchase insurance themselves. They weren't used to it. They needed a lot of hand-holding. This is where the navigators and brokers come in. People really needed someone to walk them through the process. And we also, our call center folks were definitely on demand to help explain things to people and get them through it. And then finally, you have, under federal law, you have, after you lose employment, you have 60 days to sign up for health insurance. We saw that people were not signing up within 60 days. They didn't necessarily get their checks. Their families were in an uproar that you would be, and that health insurance might not have been the first thing they thought of. So people were coming in later. Because we have a state exchange, we were able to waive that requirement on a short-term basis so that we were able to give people more time. But I think it's hard to underestimate the disruption in some people's lives who've lost their employment. They just need all the help they can get to get signed up for care.
Another question, I'll stay with you, Pam. You mentioned the public option, and I support a federal public option as well if there's legislation to do that, but it's great that Washington State is the first state in the union to do that, and that's great. You mentioned 19 counties, and we'll get back to you about which of the 5 counties, if not all of them, I represent where that's available. But you got this issue of urban and rural areas. So I have Everett in my district. I also have the San Juan Islands, and they are not alike in a lot of ways. Certainly one suburban, urban, and one it's islands, and it's as rural as you can get. A different kind of rural, say, than Ponderay County or Yakima County, but rural nonetheless. How would you assess the insurance coverage and enrollment and access to plans if you're looking at, say, a rural like a San Juan County versus a Snohomish County and Everett area?
Yeah, there is a big difference. Actually, I spend a lot of time in the San Juans, and that's the only place you get. Some of those islands you have to call the Coast Guard if you need healthcare. So
right.
It's really different, and really not very evenly served in terms of healthcare. So a lot of that has to do with provider networks and assuring that the providers are available. And that might be, we might have a redirect back to Jane at some point on that question, because that's actually something we collaborate with the insurance commissioner on. They're the ones that assure that the network that the health plan is putting forward actually is completely adequate and can be served. The public option actually brings in kind of a third entity into the state, the healthcare authority, to negotiate on those things as well. And we all kind of working together looked really hard at access and coverage for rural areas. I think it's been a struggle. And one of the things that we've done is linking participation in the PEB and which is the Public Employee Benefits Program, and the Teachers Benefit Program, linking participation of carriers in those programs with providing coverage on the individual market. And that has to do with what's an attractive line of business with what might be a less attractive line of business. And that has really helped, in addition to, I would give the insurance commissioner credit on this too, in addition to the vigilance of that office, so that this year every county has at least 2 carriers to choose from.
Oh, okay.
That's really a first for quite a while. And we're really starting to feel pretty calm that we're going to have, good coverage available statewide. And then the public option is not yet available statewide. And that's something that we're going to be working on next year to make sure that's available everywhere.
Yeah. Oh, thanks. Jane, I did have a question, a follow-up with you on that. And I would note that as a member of Congress, every once in a while, we'll get visits from the health insurers that are in Washington State, operate in Washington State. And sometimes I dread those because sometimes they come in and say, well, by the way, we're going to stop providing a healthcare plan in County A or County B or County C. It's like, that's not news you want to hear. But, about a year and a half ago, a few of them showed up and said, we found a way to, keep operating and reintroduce plans as well in some of these counties. And so it's good to hear that that's coming to fruition, that some folks will have choices where they maybe didn't have choices before. Jane, again, this isn't sort of the it's all about Rick Larsen, show, but I will note the frustration some of my constituents have when they have to change plans, or because they're looking at affordability, and that also might mean they are choosing a plan that doesn't have their current provider in it. And I would just note for my constituents, that's where my spouse and I are this year. We because of a premium increase, we're looking at a different plan, and those plans means we'll have to also change providers. Frustrating, no doubt, but we know the network we're looking at has quality physicians in it too. So I share that with some of my constituents. But how do you in the insurance commissioner's office ensure a quality, not just in terms of numbers, but a quality provider network if people are put in a position where they're having to change plans?
So we adopted several years ago a set of rules that they're called network access rules, and a lot of other people refer to it as network adequacy. Washington State has some of the most stringent network access rules in the nation. And we take that very, very seriously. And we know, Representative Larsen, that there are folks who, especially in times when we had fewer insurers and fewer health plans on the individual market, that there were times when people really were in a tough spot because maybe they had a primary care doc and a couple of specialists that they had an established relationship with. And if their health plan was going away, or as Pam knows, cost is such a big factor. And as you indicated, and they have to change plans, sometimes what folks will do is say, okay, which is the relationship that's most important to me? And they'll look for a plan that has at least some of their providers participating in the network. In Washington State, we do not require insurance plans to contract with any healthcare provider that wants to contract with them. And that is done because one of the ways that insurers try to keep premiums a bit more affordable for people is by going out and finding high quality providers and not necessarily contracting with every single healthcare provider that's out there. But I do want people to understand we have time, sort of travel time and distance standards in our rules. We have a requirement that if a health plan, for one reason or another, doesn't have enough of a certain type of provider, they must cover services by an out-of-network provider at the same cost that it would be to the consumer to see the in-network provider. But we really do work hard at making sure that there are enough specialists, that there are enough mental health providers, substance use disorder treatment providers, and primary care providers and specialists. And I think the biggest challenge about the whole thing is that when a doc signs up to participate with 3 or 4 different health plans or 3 or 4 different health insurers, what we don't know is how many patients from other health plans that physician might be seeing.
Oh, yeah.
And that affects whether that physician's willing to take new patients. So bottom line, I think we have some of the most stringent requirements in the nation, but it's not perfect. Just like the Affordable Care Act isn't perfect, it's not perfect. And I do want to say to people, though, if you feel that you need specialty care and you don't think there's a doc in your network, in your health plan's network, that is appropriate to do that, go to the insurer and ask them for an out-of-network authorization to see an out-of-network doc. And if the insurer says no and somebody thinks that wasn't justified, they can call us and complain, and we can look into it.
Great. Yeah, thanks for that. I appreciate it. And Anna, on that point, is that one of the questions you get from people as a navigator? Are they asking about the provider network? Are you at CMAR the provider network for people who call? What kinds of questions do you most get as a navigator?
As navigators, one of the most important one is the network that the insurance available is. Network is very, very important for a lot of the clients that we see. They do ask about specific doctors. If they are already seeing a specific doctor and want to keep that doctor in the new plan, they will ask for network. But yes, we as navigators will go over the network, will reach out to the insurance companies just to verify that the doctors they are seeing are still in network with or the clinics are still in network with them. If the client does want to go into more details about the coverage of each insurance company and everything, we do at one point refer them to a broker, and that's only if the navigator is unable to be more specific with that, because there is a lot of information of the coverage.
And also, Anna, I know that CMAR is committed to providing healthcare to diverse communities in our state. Maybe you may not be ready for this question. It's not a gotcha question. Is there something that we can do at the federal level to better partner with CMAR and other health care groups that reach out to diverse communities to increase access to healthcare for those folks?
I think one of the biggest obstacles that our community faces is the language. We don't just see our community, our Hispanic community, but we do see communities from all different backgrounds. I think the language is one of the biggest obstacles that we've come to. We do have bilingual navigators. We do have languages in Spanish, Russian, Punjabi, but we are looking to be more diverse to really meet the needs of our diverse community.
Yeah, that's great to know. I know in my district as well, meeting with some of the people who work with and represent farm workers, there's a rather robust Oaxacan population from the Oaxaca state in Mexico, and they don't speak Spanish. These folks don't speak Spanish, so there are Oaxacan interpreters as well working in Whatcom County, for instance. And you mentioned Russian. Again, in my district, I think, according to the last census, out of 435 districts in the country, my district was number 16 in the number of Ukrainian Americans. And even in Everett, talk about the diversity in Seattle, but in Everett, one of the elementary schools there's about 54 languages spoken at home, just in one of the elementary schools. So this issue of language is very important because eventually folks will, I suppose, as they're older and learn English, will get there, but that shouldn't mean a barrier to access to healthcare. So Pam, on that, how does the Washington Health Plan Finder work to ensure access to diverse communities in terms of sign up and in terms of education?
it's a really great question. This is a really important topic. Our website is, everything we do is translated into Spanish. And that's a very large percentage of the second language in our state. But then you really correctly pointed out that there is this proliferation of other languages. And even if people are doing well in English, you know what, sometimes healthcare is a time when you want to read in your native language.
Isn't it officially recognized as a separate language, healthcare?
I think
it's one of the world languages.
Well, we actually have a whole healthcare literacy program at the exchange, so people can understand a deductible, a copayment, and co-insurance. We have people who have PhDs in health policy who get confused when they're buying healthcare. So it is truly awful. And so it is a time when you want someone who speaks your language who can walk you through it. We can translate anything at our call center. So that's, through a service. So that's really important. But I think that for face-to-face, which is often what people want, it is really through working organizations. Our Navigator network is, we partner with community organizations so that we can be with people from the community who know the languages of those communities and know how to do outreach there. And that's worked really well for us. I would note that the federal exchange has stopped outreach dollars. And I think that's really unfortunate. And our state legislature has continued to support the exchange to provide support for navigators and to do outreach. But the federal outreach always really helped us as well, because we called it air cover, and by attracting attention and promoting things, that kind of information was also really helpful. So that matters a lot. One of the things is that we have a lot of data too, so we can start to understand, what they say is your zip code is probably the best indicator to your health status. And we now have a lot more data at the exchange. We have 8 years of experience, so we can start to understand what communities we're not reaching at all, that they're, inexplicably, people are eligible for benefits, but they're not accessing them. So we can start to reach out to these communities. And that's a high priority for the exchange for the coming year.
Yeah, and I want to be careful about this question, only in that it would be interesting for my office to understand that that zip code by zip code information without getting too deep. Obviously, you don't want to get into privacy issues. You want to totally stay away from individual privacy. But if there's numbers about zip codes where there's problematic access or something where we can step in and help, or at least promote in those zip codes, we'd love to maybe think about doing that and how we can assist with that.
That'd be great.
All right. Well, I'm sure my staff is on the call too and listening, and now they've got one more thing to do.
Good. That's a good project for them.
Yeah. Jane, on the language issue, is there a place where the Office of Insurance Commissioner plays to ensure access to this kind of information in different languages so that we can assist folks in getting access to healthcare?
Yep, I can talk about two things from the perspective of our office and the services that we provide, and also from the perspective of regulations that we actually adopted last week around language access. So in terms of our office, we have some staff that we have Spanish speaking staff, Tagalog. I'm not sure what other languages we have on staff, but like Pam, we can use sort of telephone language services and will use those. So if somebody's limited English speaking, we can make sure they have an opportunity to get to our consumer advocates. Our OIC, if you scroll down to the bottom of our landing page on our website, our landing page is translated into, I think, 11 languages at this point. So folks can sort of, at least in their language, figure out how to entree into our system and be able to reach out to a consumer advocate. Also, our complaint forms are available in Spanish, and we're hoping to be able to do some additional translations. So we're working on it, not perfect, but we're definitely, we are making a significant effort on that count. And some might have heard that last June, the federal government actually pulled back on some anti-discrimination provisions that were in the Affordable Care Act and repealed a number of rules, one of which included making sure that when people got information, there was a notice of non-discrimination, and there was also what we call taglines. So in 15 different languages to let people know, if you're having trouble reading this, this is how you can get access to information. And that was repealed by the federal government. And thanks to our state legislature that enacted legislation in both 2019 and 2020 prohibiting discrimination by health insurers based upon race, national origin, disability, sex, gender identity, sexual orientation, we actually adopted a set of rules literally last week that puts back in those provisions, those protections that were repealed by the federal government, so that for folks here in Washington state, there's no weakening at all of the protections that they have against discrimination.
Yeah, thanks. One more question about language, and it's kind of a little bit of a curveball because we've been trying to get American Sign Language, ASL, included in language programs in schools from the federal level. It's probably not describing my bill all that well, but it does beg the question: if someone is either visually impaired or if someone is deaf, how do either of them access information about the healthcare plans? Do you have the capability, the technology to help people, say, on the phone through ASL, through the technology that ASL folks use? Or do you have technology for folks who are visually impaired?
You know, I am not sure exactly how we approach that, but I can certainly speak to the folks in our Consumer Affairs Division and share that information with your office.
Please do that.
Yeah.
Love to let people know.
Yeah, we have about, I don't know, a couple of years ago, we in response to some issues that consumers raised, we really doubled down on looking at our site to make sure that it worked for people who had any number of disabilities. And this could even be cognitive disabilities as well as visual. And so we've made huge strides so that, and actually everything we put up on our website, we have to put it through a test, because these are things that you wouldn't, if you're not visually impaired, you don't think about them, or you're not colorblind, you don't think about what it does to do things like that. So we've been able to work pretty dramatically on our visual system so that people who do have disabilities should be able to get what they need through the exchange.
Well, we're almost at the end of our hour, and what I wanted to ask each of you at the end here is just for maybe one last time, give one piece of contact information, whether it's the website or the phone number, just so anyone who's watching on Facebook Live, get your pencil, get your pen, get your smartphone ready to put in a new contact. Whatever you're going to do, get ready, because you're going to get contact information. Pam, Health Plan Exchange, what's the contact?
WAHealthPlanFinder.org, and we also put it up on the on your Facebook site for this presentation.
Great, WAHealthPlanFinder, all one word, .org.
Right.
Great, thanks. Jane?
So for us, if you go to www.insurance.wa.gov, right on the top of our opening webpage, you'll see a link to submit complaints. And also, if you want to learn more about the Balanced Billing Protection Act, up on the top banner, you'll see a little link that says current issues. And if you click on that, there's a bunch of information about the Balanced Billing Protection Act. My highly technical term, a bunch. And again, our phone number, 800-562-6900.
All right, and that's the Insurance Commissioner's Office. Thanks,
Yes.
Jane. And Anna, contact info.
Yes, to get in contact with one of our navigators, please call 1-855-289-4503.
That's great. Thank you all for taking time. I know it wasn't just 1 hour. You probably did a little bit of prep time too, and I appreciate you putting in the time to prepare for this Facebook Live. But also, I really want to thank you all for the time you're putting in to increase access to healthcare for folks in Washington State. We are a leader in healthcare and healthcare access in Washington State, and we can always do better. And I know I can always do better as well. But I really appreciate the expertise, the time, and the passion that you all are bringing to this job. And it really shows, because Washington State's a leader in healthcare, and it's great. It's great to be having been born and raised in Washington State and getting to represent a tenth of the population. It's just an honor to be part of our state, and I really appreciate being able to bring you all together and help out my constituents today. Thank you all so much.
You're welcome. And we really, really appreciate how much you've supported the commissioner in his efforts and Pam's efforts and the state legislature's efforts to make the ACA as successful as possible in Washington State.
Yeah, it's been a labor of love for sure. Absolutely.
For all of us.
Yeah, great. All right. Thanks a lot, everyone. Thanks.
Thank you.
Take care.
You.